Good afternoon, ladies and gentlemen. Our webinar is beginning. Steve Love with the Hospital Council. I want to thank you for being here today. This is another one of our educational webinars, and it's hosted in coordination with Heart Healthy Community, who is a very active associate member of the Hospital Council. Today's topic, strategies to improve heart health education. The heart health community is really an innovative opportunity for healthcare employees to share interest, research, news, and education. It also is a very effective way to manage customer relationships and attract new patients. We have a speaker today, Stephen Page. Stephen is the chairman and CEO of the Heart Health Community. If you visit the website hearthealthcommunity.com, you will see a virtual library of very important information and tools. It's quite impressive, and it's a great resource for healthcare professionals. We have a tremendous turnout today, and we're looking forward to Stephen's presentation. Before we begin, please note if you have any questions, feel free to either type them in the question box or the chat box, and we will answer them at the end of the presentation. With that, it is my pleasure to turn this over to Mr. Stephen Page.
Thank you, Steve, for that glowing introduction. And before I start, I want to thank you and Chris for organizing this webinar and for the wonderful work you do within the Dallas-Fort Worth Hospital Council. It's really been a privilege to become associated with your organization, and you run it very, very professionally. Let me step through our presentation. That'll be a PowerPoint presentation that's available after the webinar. And then I'll actually take the attendees through a physical presentation of the Heart Health Community platform. So I'm just going to talk about some obvious things. Heart disease is the #1 killer in America. Over 50% of Americans will die of heart-related disease. It's a very expensive thing to manage. Last 2 years ago, Americans spent $220 billion on heart health disease. And that spend, or that cost, is estimated to grow to $800 billion by 2030, largely due to incredibly sophisticated innovations through robotics, artificial intelligence, machine learning, and other technology advances that we'll discuss later. Every year, 30 million Americans visit a cardiologist and/or a hospital for a heart-related problem. There are only 23,000 cardiologists in America. Demand definitely outstrips the supply. When you have a heart health diagnosis, you generally spend about 10 to 20 minutes with your cardiologist and you ask questions. The patient or a loved one has hours worth of questions, and cardiologists and their staff don't have the time or the resources to educate patients on all aspects of heart disease management. If you go to the internet, you do a Google search for any one of these heart-related terms, you are met with millions of search results, and no one has time to go through all of these search results to find what is in fact professionally curated and authentic information and not misleading information. Generally, a heart health patient goes through 4 phases. They're researching a disease state because they or a family member have it, and they want to find out what this is and what they can do about it. Second, they have a critical event. It's a heart attack or something really dramatic, and they want to make sure if they survive that never happens again. Luckily, they recovered. They survived the critical event, and now they want to find professionals to help them with curated information to manage their or for a loved one's heart health journey. And now they're in maintenance. Where do I find the people to share these experiences and help create some positive impact out of this experience? So there's a lot of people devoted to heart health, and there's a huge amount of cost, and there's A lot of hospital systems. There's over 6,000 hospitals, 23,000 cardiologists, 5,000 vascular specialists, and then a lot of other stakeholders, physical therapists, dietitians, nutritionists, physician assistants, nurse practitioners. And if you look at LinkedIn, there's over 2 million healthcare professionals that operate within heart health care. If you're lucky enough to live in a big city, and I live in Dallas, Texas, you're in pretty good shape if you have a heart-related type disease. There's over 30 hospitals in Dallas that are capable of providing heart health services. You're not so lucky if you're living in a rural area. The rural areas, and there are at least 4,000 hospitals in rural areas, they're not staffed with the level of sophisticated professionals usually that you find in big cities. There's a lot to learn about heart health innovation. This is just a list of some of the things that are beginning to happen or are happening that will change the course of heart health therapies in the next 5 to 10 years. Stem cell therapy, nanotechnology, robotics, precision medicine, digital health platforms, all of these will contribute to the improvement of heart health. So how do we achieve heart health equity? How do we create a platform and a system and process where all patients and their loved ones have equal access to professionally curated information and resources, enabling them to effectively manage their heart health journey? This was really the core problem we set to solve when we embarked on creating Heart Health Community over 2.5 years ago. How do we provide equal access to professionally curated information regardless of your geographic location or socioeconomic status? I know several of the Dallas-Fort Worth Hospital Council members serve patients in remote areas, for instance, in South Texas, where Vietnamese is a very, very popular language and culture. And in fact, some of our members serve people in other countries. We're going to show you some whiz-bang technology with the platform that helps our platform and all of its content translate into 121 different languages instantly at the click of a button. So another question we asked ourselves, how do we engage patients in a supportive community wherein the patients find and connect with others to share their resources and experience and mutually support each other on their heart health journey? And how do we empower patients to take control of their heart health journey? One of my favorite sayings in this journey is, better educated patients lead to better health outcomes. And that adage instructs everything we do. So present limitations to creating heart health equity are patient engagement. How do providers engage their patients and customers today? There's very limited one-on-one marketing and very minimal sophisticated target marketing by major hospitals. Patient education. How do providers educate their patients and customers today? A few providers provide excellent patient information, educational videos and information. Unfortunately, most do not. And I think of the obvious examples, the Cleveland Clinic, the Mayo Clinic, that spend an extraordinary amount of money and resources with excellent materials. But sadly, most hospital institutions do not. And then how do providers empower their patients and customers today to manage their heart health journey? And unfortunately, the answer is the same. Today, most do not. So forgive this busy slide, and it is my favorite consulting saying. If anything were possible and there were no constraints, what could be our future heart health equity objectives? Well, we'd want to improve patient outcomes. We want to have better communications between the patients and the providers. We'd want to increase patient engagement. We'd want to streamline care coordination, and we'd want to improve the efficiency of the delivery of heart health care. And if we could actually improve or increase cost savings by a much more comprehensive delivery system, we'd have achieved multiple objectives. We looked at who is out there with products and services that could be competitive to the heart health community. And I highlighted what are the functional requirements that we want to achieve. So we wanted a proprietary community. We wanted a mobile app. We wanted to aggregate all of the heart health resources in one setting. And in our case, that's over 40 categories and over 2,700 separate resources. We wanted to create a marketing hub for professional groups, and that means hospitals, doctors, hospital systems, medical device companies, physicians, physician assistants, PTs, nurse practitioners, associations, medical schools, and anyone involved, any stakeholder within the heart health industry. We have some very sophisticated technology driven by artificial intelligence and machine learning. We've curated over 50 newsletter sources, and we built a library of over 500,000 articles. The heart health community is free for individuals to join. It's free for anyone to join. When you do join, you indicate which of the 40 heart conditions as defined by the American College of Cardiology interest you. And we have the ability to deliver a newsletter to you on a monthly basis that contains content that is specific to your heart interests. Every person gets a different version of our newsletter. And then we will ultimately promote healthcare industry jobs and events, and we'll do that within the platform. And all of the current alternatives do some or none of these things. We've tried to achieve all of these capabilities in one platform. So this is what the platform looks like. When you come, you see these categories, and they're sorted out into 40 categories, and you select which category might contain the information or resources you need to manage your heart health journey more effectively. And our drop-down menu is as simplified as it can be. Under news, you will see the 50 different news sources. You will be able to select on any one of those news sources and either see all the news from that particular news source presented in date-stamped order, or you can use the search bar to search for a search term like AFib, and all of the articles that are produced in date-stamped order from all 50 publications will be presented in one way. Under Learn, you'll learn about the heart disease descriptions, and then the conditions, and then the procedures to fix them, vascular conditions, vascular procedures to fix them, and other disease states. Under hospitals, you'll be able to find hospitals by hospital systems, the hospitals themselves or clinics. Under professionals, I didn't know this until we started this journey, there are 9 different flavors of heart health professionals that administer to people with heart health issues. Then you can look at all our members, and you can look at all the resources in one place. We believe, and we have looked, that the heart health community is a unique first-to-market heart health, patient engagement, education, and empowerment community. It contains over 2,500 professionally curated sources of information and resources organized into 40 categories. We support rural and at-risk communities. The HHC platform is ADA compliant, and its navigation and content translates into 121 languages. We want HHC to help our hospital clients drive patient engagement and function as a marketing hub for heart health professionals and their related businesses. We help hospitals engage their patients. I had a journey with one hospital. It's a member of the Dallas-Fort Worth Hospital Council, and they frankly saved my life. And the cost of this procedure was well over $100,000. I would have hoped to have got a Christmas card or some sort of ongoing reach out or engagement, and sadly, I did not. And that strikes me as a missed opportunity for hospitals serving their patients. So we have created a marketing hub for hospitals to better engage their patients. And I'll show you an example of that when we get to the live part of our demonstration. And the same thing for hospital groups, the same thing for the physicians that support us, the same for the individual physicians, and what a website or a professional group would look like for a physician. And then we describe heart conditions. So we are members of the American College of Cardiology, and I checked with ACC before we did this. they have a wonderful website called cardiosmart.org in which they define 40 heart conditions. The website is a little outdated, and when you go to look at any one of these 40 conditions, and we'll explore heart fib when we get to the live demonstration, you might have to page through 10 or 15 pages of information before you get to questions to ask your doctor. We reorganized with permission their information. We put it on one page. We allowed you to share it via social media. We allowed you to join the group and compare your experiences with other people interested in the same condition via QR codes. And we added videos that were professionally curated that could explain the condition in video form if you weren't interested in reading. We did the same for the procedure side of heart health, and we did it for 25 vascular conditions and then the procedures to resolve vascular conditions. Our objective here is to provide health education in a professionally curated way from professionally curated sources so that members of this community don't have to go through millions of search results with dead-end type outcomes. So we've also done this for associations. We've done it for medical schools. We've done it for digital health innovation companies, and we've done it for news sources. So when we get to the news part of our demonstration, you will see the aggregated news sources from multiple sources. And we've created and installed, using this globe button on the main menu bar, the ability to translate this platform into 121 different languages. The newsletter that we've created allows a sponsor, in this case it could be a hospital, it could be a pharmaceutical company, it could be a med school, it could be association, to send a professionally curated newsletter to all of their, in this case it's done for a hospital and their patients, but this has the effect of engaging the patient on an ongoing basis with the brand of the provider. In this case, it's Baylor Scott & White. So what is our value proposition to the professional community that we want to serve? We want to save cardiologists staff and time after a heart health diagnosis by providing a trusted source of professionally curated resources and information, and help them engage, educate, and empower their patients. We want to help drive revenue for hospitals and cardiologists by enabling them to serve more patients and acquire new patients from outside the primary care physician referral network. We believe that by educating and empowering patients to more effectively manage their heart health journey, hospitals will benefit from increased Medicare reimbursement rates due to a reduction in return visits to resolve the same issue. I am going to clearly state at this point, this is unproven, but we believe this to be the case. And we think we will help hospitals create heart health equity by enabling all socioeconomic strata to access professionally curated information and resources on a free-to-consumer platform, enabling them to more effectively manage their heart health journey. The next part of the question always is, well, how does HHC make money? Well, we are what's called a platform as a service business. And think of this like LinkedIn for heart health. Heart health professionals and related businesses pay a monthly fee to host a professional group, which in effect becomes an adjunct or their professional website within the heart health community, and our fees are based on the number of individuals served within a professional group. We additionally charge premium fees to feature professional groups, videos, job listings, event listings in each of the 40 categories. And we are a marketing a website community marketing hub for heart health professionals, and we're significantly more function feature rich than currently utilized patient engagement marketing platforms. So this will be sent to you afterwards, but we charge incredibly modest fees because we hope to do this at volume. If you're managing less than 1,000 patients in your relationships, you're going to pay $100 a month to manage a professional group for us to build and manage a website for you, which is in effect your professional group within the heart health community. If you're managing between 1,000 and 10,000 patients or customers, it's $500 a month. If you're managing between 10,000 and 100,000 patients, which is most hospitals, it's $1,000 a month. This is a fraction of the cost that would be required to pay a social media person that couldn't do 1/10 of the things or deliver the functionality that the heart health community platform can. And if you're dealing with millions of people, call me and we'll talk about enterprise pricing. So that's the narrative presentation of this. And if everyone's ready, we'll do an online presentation, and I'll get rid of this platform. And we'll go to the heart health community platform. Can everyone see that, hopefully? So we'll start off with heart conditions. And again, we went to the highest source of information we know in America, which is the American College of Cardiology. And if you look at their website, which is called cardiosmart.org, AFib is defined with these 15 pages, and you have to get to page 9 before you get to questions to ask your doctor. With their permission, we took that information and we coordinated it and put it on one page. And we allowed you to join these groups. So if you were an AFib doctor, you could invite your patients to join this group. And we have a QR code over here. And if you clicked on this with your iPhone, you would download the HHC app, and then you would be taken to this group where you could say, I want to join as a member. Or if you were the admin like me of this group, I could invite you to join this group by sending this link out. So this invite to join your group is present and viewable by any admin for any professional group. So if you were building a group like this on behalf of a hospital or on behalf of a physician or on behalf of an association, you would use this group to invite your constituents to join your group. One of the cool features of this, we've added professionally curated videos from multiple sources to each of the heart conditions. And they're all hosted on YouTube, and that's because the American Association of Disabilities wants you to be able to audio and sight read videos. And the only place that does that consistently is YouTube. So when you upload a video to YouTube, it automatically becomes ADA, American with Disability Act compliant by adding closed captioning and sight impaired capabilities. So all of these videos exist for all of the heart conditions. We also have descriptions of heart procedures. So if you wanted to learn more about how do you resolve AFib as a condition, you would go to the procedures version of this platform, and there would be information that describes exactly how professional physicians would attack or approach this issue. We do the same for vascular conditions, and we've identified, with the help of Dr. Tony Das, the 25 most prevalent vascular conditions. And Dr. Das has functioned as our Chief Medical Officer for the last 2.5 years and has helped us design this platform. And let's take a look at Dr. Das. So Dr. Das is the CEO of Connected Cardiovascular Care. He is also on staff and is head of digital health strategy for Baylor Scott & White, the Heart Hospital Plano. Dr. Das has a sophisticated individual website, which is rare. 85% of cardiologists work for hospital systems, and the majority of them rely on the one-page pro forma resume that hospital systems put up to describe their capabilities. Dr. Das has a 30+ page website that describes all of the conditions he treats, how he treats them, how he goes about resolving these issues on behalf of his patients. And it's a very, very comprehensively well-built website. We put all that information on one website. We allowed Dr. Das to invite patients to join his group. This QR code, again, can be sent to his patients and they will join the group. There are videos that talk about what to expect when you go to meet him and what are the conditions he treats, etc. This becomes a marketing hub for those professionals. We've built about 2,000 of these for cardiologists to date, and we'll ultimately build 23,000 of these, one for every cardiologist. Unlike the LinkedIn profile, that allows you 2 affiliate links, our profile platform allows you up to 7. Tony is, or Dr. Das is, the CEO of Connected Cardiovascular Care, his clinic. He is on staff and the head of digital health strategy for Baylor Scott and White Heart Hospital Plano. He's a fellow of the American College of Cardiology. He's a founding board member of the Vascular Intervention Advances Association, and he went to Stanford and Harvard. This is a really attractive sign or platform as opposed to the one-page profiles that most hospital systems put up. Let's look at some of the other resources you might need. So let's say someone got a condition and they're looking at the associations that support their condition, and we'll use the American Heart Association. And here is an ability for the American Heart Association to aggregate all of their members, to promote giving to the American Heart Association to support all of the worthwhile research that they do. And this group was designed to engage the volunteers for the American Heart Association. And we have research that prove that people engaged in online associations tend to give or donate 25 to 40% more than their non-engaged peers. Other resources include physical therapists. So if you or a loved one has a stroke and you need to find physical therapists to help you recover and get back on your journey, we have physical therapists. And there are a variety of physical therapists, and I didn't know this before I started this journey, but of about the 210,000 physical therapists in America, 7,500 of them have a doctorate in physical therapy, hence the DPT designation. And we can support those people with a patient engagement platform to help them grow their individual practices, just as we can with the physicians themselves. We have medical schools. If you were interested in particular research activity for medical schools, we've listed the top 50+ medical schools. Actually, I think it was 80 medical schools here. And you can go to any one of them and find alum. You can find out what they're doing. And many of these are research schools as well. And then for hospitals, which are mostly we're focused on today, we built hospital groups for a variety of hospitals, and you will see there's at least 50 of the most popular hospitals here. And for instance, the Heart Hospital Plano, Baylor Scott and White, the Heart Hospital Plano is a customer. They're our alpha customer, and they will ultimately invite their patients to not only join their hospital group so that their patients can receive a newsletter, but they will invite new people to come and become aware of the excellent heart health care that they can provide their patients. I believe the Heart Hospital Plano does more heart procedures in Dallas than the rest of the heart hospitals in Dallas put together. It's an extraordinarily productive and effective place with some of the best. There's over 220 heart health professional physicians that work within the Heart Hospital Plano, Denton, and McKinney. It's an extraordinary aggregation of talent. And we also have clinics. So if you have or operate a clinic, we can also be effective in aggregating your patients. So again to Dr. Das's clinic. We built one here for him, and this is his platform and how he goes to market and describes his services with his professionals. But we also did one for Dr. DeMaio, who is a professional and is the Chief Operating Officer for the Heart Hospital Plano. And they have a surgery clinic that does cardiac surgery with 15 professionals. So we profiled all 15 professionals within our platform, and we created professional groups for every one of the practitioners. So not only were they affiliated with their the clinic that they're employed by, but they can also invite their patients to join their own group. And in Dr. DeMaio's pedigree, he actually ran heart transplant for UT Southwestern before he became the Chief Operating Officer of the Heart Hospital Plano. He's an incredibly accomplished professional, and he ended up maxing out on our affiliate links. Let's go more into the affiliate links. So if we look at other disease states, we have started off and we focus on heart health diseases because they're the most prevalent and they're the most impactful. But there are many other disease states, and we talk about some of them. And as this platform develops, this will become perhaps a global health community, not just heart health, but it will address cancer diseases, diabetes and related diseases, and other diseases. But I want to show the power of an affiliate link here for a second. So for those just starting on a liver disease journey, this describes liver disease and describes the 4 stages of liver disease. But what's this? This is an affiliate link. So we'll click on that. And this could be a resource link, and they're presented by geo presentation. So if you were in England, you might get a different video, an affiliate link. But Perspectum is a new emerging technology company that's received $50 million in funding. It grew out of Oxford University in England, and obviously I'm English, so I'm very, very biased to this. And they have developed some really whiz-bang technology that allows MRIs to reinterpret what's really going on with the liver. And they, in the majority of cases, negate the need for a physical biopsy by reinterpreting an MRI and coming up with real insights about what the disease state is that's calling the disease. We have multiple examples of digital innovation companies, so we'll go and take a quick look at some of those. And these are the digital health innovators that are bringing the new technology to market. And they're all looking for ways to engage their patients. They're all looking for ways to engage their customers, and we're it. Now, McKesson is a well-known service provider to hospitals and physicians throughout the country, one of the largest. But let's say I'm trying to learn about McKesson, and I want to speak Spanish. This website just translated to Spanish and can translate to 120 other languages in the flick of a switch. So it's incredibly helpful in creating heart health equity in places like South Texas, which have a huge Vietnamese population. If you wanted me to translate this to another language, I could. I'm mindful of my time because I know we're going to get into question and answers shortly, but you can also present events, you can present jobs here, you can look at the resources by professional. There's lots of different navigation tools to do this. And the last part of the presentation will go to the news section. Here are the 50 different resources for news. And if I wanted to do a search on our library of over 500,000 and counting articles that we've aggregated, I'll put in AFib, and we must have looked at something strange there because all of the articles on AFib would normally come up and be presented in this activity. if we wanted to just go to one source and look at the information or the latest news feed from one source, here it is from the British Heart Foundation. Here's all the latest posts they've created. We haven't seen anything like this where we aggregate news from 50 different sources. We have them presented either individually or collectively for you, and it's easy to get around and navigate. So in summary, better educated patients lead to better health outcomes. For individuals, HHC is a patient empowerment and education community. For professionals, we're a marketing hub that drives revenue for hospitals, physicians, and businesses. And if you click on this call to action button, you can invite a friend. If you go to the App Store, you can download the latest version, which just went live 2 days ago. You can download the latest version of the Heart Health Community mobile app. And with that, Steve, I shall give that back to you for questions and answers.
Okay, thank you, Stephen, and thanks for a very comprehensive presentation, and we appreciate the manner that you went through it, even demonstrating the website. We do have a couple of questions that have come in. You know, I guess looking at it strictly from the hospital perspective, in your mind, what are the hospital benefits of becoming a member of the Heart Healthy community? I know you covered them in your presentation, but what would you say would be the key benefits for a member hospital?
So I'll start with the first one, and it's patient engagement. And I gave you the example of a hospital that treated me for what became a life-threatening situation, and I've never heard from them since. And you would think after experiencing that, they would be engaging me with a newsletter or some sort of, you know, is there anything else you'd like? If you take your car in to get an oil change and they always take your email address, you're going to get peppered with, you know, you've driven 5,000 or 10,000 miles. It's coming, you know, time to come in and get your oil changed. Unfortunately, the heart health industry, or the health industry per se, seems to be behind the times in terms of marketing or customer engagement. And they're wonderful at providing care. They saved my life. But they're not very good at engaging patients. And so for the first, why would you do this if you were a hospital? This is a wonderful way to engage your patients in ongoing care reciprocation from your institution and by your physician that are on staff. For instance, I think that patients will become the future currency of healthcare. And by that I mean, we have a lot of resources in Dallas and any big city that have the ability to provide heart health care. And the bigger the city, as I showed in one of those charts, the more hospitals that are likely to have resources to care for you. In a rural community, that's, you know, you're lucky if you can find someone that has the ability to provide sophisticated care, heart health care in a rural community. But all hospitals need to be mindful that there's going to be competition for the patients in the future, and particularly for very, very expensive heart procedures that can easily cost over $100,000 per procedure. So engaging the customers and getting them loyal to your brand, to your facility, to your physicians within the facility, to treating all conditions within your brand or within your network of hospitals, I think will become a driving issue for marketeers and CEOs in the future. Next, educating patients can really help manage down the cost of heart health care. So in the case of a cardiology journey, a patient comes, they get their diagnosis, and they're not quite sure, they didn't hear it all right, and they want to come back and hear it all again. Well, that's another visit. And Medicare, for instance, takes a dim view of that. If you fix someone once and they go away and they don't come back, you might get the maximum premium or the procedure value that they agree to pay. But if that patient has to come back 3 or 4 times to answer questions that could be answered by a platform like this, Medicare is going to ding you for the cost of those return visits. And they're nothing to do with the care you give. It's just that the patient came back to you to find answers to questions that they have. So from an education point of view, this hub can really save physician and staff time. You can direct the patient using QR codes to each of the heart conditions, to each of the vascular conditions, to each of the procedures to resolve those. And you can really help the patient become self-empowering by providing that lead information, and that'll save you time at the physician level and at the staff level. And then for empowerment, if you empower the patients, they're going to have better health outcomes. They're going to know that they need to lose weight. They're going to know that they need to rehab properly. They're going to know, here I found the dietitians and the nutritionists to help me achieve some of those objectives. So those would be my 3 answers for that question, Steve. Engagement, education, and empowerment.
Thank you. Those were good answers. A follow-up to that question, you mentioned about once you have had your procedure and you leave, there could be a lost marketing opportunity if you don't hear back from them, i.e. through a newsletter or some kind of crafted information. With Heart Health Community, is that one size fits all, or can you craft that communication to be specific to an individual?
Well, first of all, it's a great question. So whoever asked that, thank you. But then I can't believe I didn't answer that. And if I didn't, shame on me. The Heart Health Community Platform was built by the original developer of the Match.com platform. And I can't tell you how many times I tell that story and people come up to me and, well, I got married because of Match. You know, the platform became incredibly clever at matching you with people that would share your interests. Well, that same artificial intelligence and machine learning technology and software has been incorporated, not exactly the same, but the same principles, into this platform. So when you join, when an individual joins this platform, we ask in a Chinese menu sort of way, you just click buttons, which of the 40 heart health conditions interest you? And you can pick 1, 5, 10, or all 40 of them. It doesn't matter. But what you select then affects you by what newsletter you get. So in order to receive a newsletter, you've got to become a patient, or you've got to join a professional group. And that could either be your doctor's group, it could be a hospital group, it could be an association group, but you join some group. And then every month you're going to get a newsletter that's electronically and individually curated that contains news and articles that are specific to the 1 or more heart conditions that you indicated an interest in. And then most importantly, if the source of the newsletter generated is a hospital or a physician, we have the ability to brand the newsletter. It's XYZ Hospital and it's from XYZ Physician. So this is a double opportunity from a marketing or an engagement point of view to provide individually curated information to the patients that you're serving.
You know, that brings up kind of another question, because you've specialized it, it's individualized. You've talked about setting up groups, you know, where you can use the QR code, you can be invited, you interact with others, you interact with your physician. I'm doing that to set the stage. Hospitals, as you know, and all providers in the medical community respect privacy, and they have to be HIPAA compliant. Is the heart health community meet all of those standards of HIPAA compliance? I just want to make sure we're not in any way breaching confidentiality.
So that I'm going to have to take you on the road, Steve, if you keep this up. You're being a wonderful straight man for me. The Heart Health Community Platform is definitely not HIPAA compliant because we do not want to have any medically orientated patient information on this platform, and B, we don't offer medical advice. You got to go to your hospital or your physician for medical advice. So by design, right from the beginning, we determined that this would not be HIPAA compliant because we don't want to maintain or host professional medical information on this site. This is, or when I say patient record information, this is an information resource. This is an education resource. This is no different from going to do research on Google, or it's no different from joining LinkedIn in terms of joining a community. In fact, we make it a lot easier to join this platform through all of the existing social media connections. But we determined a long time ago not to make this HIPAA compliant. If we ever did that in the future, Steve, that would be a different version of this. But for the foreseeable future, this is an information and resource community. It's not a patient record or an electronic patient record or any electronic health record. It's not meant to be any of those things. It's purely a patient education, engagement, and empowerment resource.
Here's another question. What would you say are the key steps or the requirements to implement heart health community within a hospital system? You know, when you think in terms of IT constraints, et cetera, what are the steps that a hospital would have to go through?
So let me backtrack a little bit. Another great question. Thank you, Steve. Let me backtrack a little bit. We know of a major association, one of the biggest for the health profession, over 1 million members, that tried to build a community platform like this to engage their members, and they spent $8 million trying to do it, and the IT project failed. We know of another major association that is listed in our association list that spent multiple millions of dollars trying to engage their volunteers, and it failed. And we know of a very large Fortune 50 company that spent $40 million trying to build a community platform like this, and it failed. So if hospitals want to build a community platform like this, it is a very expensive proposition, and it will take years to build, and there's a good chance, at least a 50% chance, it'll fail. Or you can rent this platform by the drink, and it's very, very inexpensive. You know, at its worst case, $1,000 a month if you're treating up to or engaging up to 100,000 patients. It's a fraction of the cost of a full-time social media professional. Then we get into the actual implementation. This has to be sponsored top-down. It has to be sponsored by the CEO or the owner of the business. And the reason for that is it impacts a lot of areas. It impacts marketing. It impacts the chief medical officer. It impacts if you have a health equity officer. Anyone to do with marketing, anyone to do with management is going to be impacted by this. And that sort of change is better led from CEO down. So if you're thinking about introducing this to your professional setting, the first thing I would do is engage the CEO and make sure he or she wants to go on this sort of journey because it's not trivial. The beauty of this platform is it's a cloud-based platform. It's just like LinkedIn. It's just like Facebook. It's hosted on Amazon Web Services. And there are 2 different iterations of this on the East Coast and West Coast. In case one of the coasts fall into the water, this platform will keep operating. But as we get into implementation, we have developed implementation guides for both physician practices, clinics, and for hospitals and hospital systems. And if anyone would like to receive copies of those implementation guides to understand what are all the steps they need to take to implement a platform like this within their community or within their environment, all you have to do is reach out to me at spage@hearthealthcommunity.com, and I will send you whatever the requested material is.
Let me ask you this question. You put a lot of good information out on the website, and as I mentioned earlier, HIPAA compliance, et cetera. You know, anytime hospitals, and it's a good practice, as you well know, engage in any contract, it's going to go through legal counsel. How do you give them comfort? You mentioned it in your presentation. Hey, we took these 16 pages and we condensed it to one page. How do we make sure that nothing's being copyright infringed or anything like that to give the hospitals comfort this has been thoroughly vetted?
So let's go back to, are you still able to see our presentation, Steve?
Right, right.
So
Yes,
let's
we
go back
are.
to let's go back to AFib. And we considered the American College of Cardiology, at the recommendation of Dr. Tony Das, who is a world-class cardiologist, we considered the American College, or ACC, to be the highest authority on the definition of what the 40 disease states were. And again, their website describes the 40 disease states as topics, and there they all are. So we joined ACC, and I luckily have a letter in my file that said we were building this community and we liked their information the best. And would they allow us to take their information and reformat it and put it in one page? And then most importantly, after a definition of the disease state, we put at the top questions to ask your doctor, which is what we believe to be the most important piece of information. If you imagine getting a heart health diagnosis and you're sitting in the doctor's office dealing with that for the first time, you're in shock. You didn't know what this was, and now you're thinking about your mortality and everything else, and you haven't properly prepared for this 20 minutes you're going to get with a world-class expert cardiologist. If you were aware that this website existed and you downloaded this before you went into the doctor, and you looked at these questions and said, which one of these questions apply to me? You are much better prepared to have this conversation with your physician than someone that hasn't seen this information. And I can assure you, if you go and look at AFib, the cardiosmart.org doesn't come in the first million search results as you go through Google search results looking for AFib. So finding this information is hard. But ACC was comfortable with us sharing this information on three conditions. One, we wouldn't charge individuals to see this, and the Heart Health Community Platform is free for individuals to join. Two, we had to attribute the source to the American College of Cardiology, which we did. And three, we had to provide links back to their website, which we do. So we actually attribute the source of this information twice, the website to get back to CardioSmart here, and then we attribute the source here. So this, in effect, becomes a marketing adjunct for the ACC. Their professionally curated and blessed information is shared professionally in a controlled environment where only we, the administrators of the heart health community, can update this information. And we're running everything by professionals before we publish it. So we're trying to become the highest level of information on all of the different aspects of heart health information that you would need to manage a heart health journey. And sometimes it's technical information like this, Steve, but other times it's other things like resources. My father had a stroke. I need someone to come in and manage his care at home because he can't get out. So where do I go to find home care professionals that have the ability to manage those situations? So we've identified those companies. And when I first asked that question to our team, we didn't know them. We didn't know these companies have individually bonded and professionally screened individuals that are licensed to come into your home. But if you're trying to find someone quickly, here are all of the people that could come in and help you manage that personal, tragic journey. This is an incredible aggregation of resources, Steve. Over 2,500 different groups of information sorted by these 40 different categories. And by the way, if anyone can think of additional categories of information to add to this that would help people manage heart health journeys more effectively, please get in touch with me. And we do have an extensive footer on this website. And if you want to go to all of the heart conditions by name, just click on any of these and it'll take you to those groups. There's a tremendous amount of legal and thoughtful work that went into how we structured this platform and what were our legal positions in terms of our terms and conditions, our privacy policies, our GDPR policies, our ADA policies. There's an information kit here that will help you understand the questions that the heart health community answers for hospitals and physicians and other care providers. You can schedule a demo if you want, or you can actually do anything. You can download an information kit that describes this in a PDF form that's reasonable. And we added you, Stephen and Chris, to our membership roster of people that we're proud to be associated with.
Well, thank you. One final question, and it works out good because I think we have time for one final question. In your answer, you mentioned one of the requirements was this information for individuals you couldn't charge for. How do people sign up or go to this information so they can see it and examine it and it's no charge to them?
So they become a member of the heart health community, and behind my control screen here, there's a sign up or login capability in the top right-hand corner of the website. So I encourage anyone listening today, go and sign up. It's free, and you don't have to build a professional group. And once you've signed up, you have access to all of this information at no charge. If you're a professional or a hospital and you want to build a professional marketing hub group, contact us, spage@hearthealthcommunity.com, and we will build a group for you that contains the content that you want representative of your offering, and we will work with you continuously to update that content at no charge. So in effect, if you're serving less than 1,000 patients, you'd be getting a website or a marketing hub group for less than $100 a month.
Well, Stephen, that's good questions. And we always get one question, which I know Chris is going to send the slides out to the people that registered related to this. But, you know, you've done a really good job of time management, Stephen. You covered a lot of information very effectively, and we thank you. That's all the questions we have, but on behalf of Chris and me and the people participating, we thank you, and we'll give you the final word before we sign off.
Well, I can't thank you all enough for taking a valuable hour out of your day to listen to this presentation. What you've seen is the result of 2.5 years of work by a dedicated team in 3 different countries to build this platform. We're incredibly proud of what we've built, and we really hope it does help individuals manage their heart health journey more effectively. And we hope the businesses that the platform supports are also positively impacted with this platform. So I remain open to any questions or suggestions. Chris and Steve from the Dallas-Fort Worth Hospital Council will be following up with the slide deck and any other information you might request. And Steve and Chris, thank you for hosting this webinar. It's been very enjoyable to do.
Thank you very much, Stephen. And for everyone attending, we thank you for your time. And this ends our webinar at this time. Have a good day.
Thank you, Steve.
Thank you.